Ignite the spark with Dr. Angela's eye. Step into the future shining bright, helping students reach new heights. Wellness care with Rob, you so right. Business with my boo, we take the lead. Hospital beauty serving those in need. Podcast flames we plant the seed.
So hello, everyone, and welcome to Ignite Your Next Phase with Dr. Angela. Let's talk about it. I'm your host, Dr. Angela, and I'm so excited to have you all here with me today. On this podcast, we talk to people 50 and older who are entering their next phase, their best phase. So today's podcast is being sponsored by Next Level Health and Wellness. They specialize in functional medicine, hormone replacement, weight loss with GLP-1 medications, and lifestyle changes. If you're ready for your weight loss journey or your health journey, give them a call, 248-662-5044. So we talk about people's life, their love, their careers, their reinvention, and their health. Today's podcast, I've got my good friend and colleague, Deborah Curtis. Welcome back.
Hello.
So on the last podcast, we discussed metabolic health and functional medicine. And we're going to continue to talk about some health issues that affect many of us nowadays. So for many years, many of us were told that weight management was simply eating less and moving more. But science has taught us that there's a little bit more to that story. It may involve your hormones, your metabolism, sleep, stress, aging, genetics, and other environmental factors. Whether you're a woman navigating perimenopause, menopause, or a man noticing decreased energy or body composition changes, or someone who has always struggled with their weight despite doing everything right, this conversation is designed for you. So let's kind of get into it. So welcome, Deb. Glad to have you back.
Always happy to be back here with you.
Okay.
Our conversations on and off.
Oh, yeah. So how are you doing?
I am good. It's a good day.
And you're looking amazing today. Very pretty.
Thank you. You too, my friend, as always. As always.
So I'm happy to have you back here with me today. So let's get into it. So why is obesity so complicated, where we were told calories in, calories out, or move more, push away from the table, just stop eating?
Yeah.
So let's talk about how complicated weight loss and weight management is.
Wow. It is. So many people, what you just said, calories in, calories out. People think if they stop eating. I'm glad we're here at this somewhat stigma right now, because when they see someone who's obese, as we know, obesity is a chronic disease. And you see somebody walking around and they're overweight and they may not be eating very much at all.
Right.
But the first person, people assume that they're just eating too much.
Right.
Just like you said, push away from the table, you do better. Or if they go to some doctor's appointment and say, you need to lose weight.
Right.
And they think they're supposed to just eat less.
Right.
So now they're starving, body's holding on to what the little bit of food they do have, and they still can't lose weight. And I think we just have not been taught, when I say we, the medical community for so long, are the ways that affect us with weight loss. Nutrition, as important as nutrition is, we just weren't taught that.
Right. Well,
weren't
that's true too. That is true too. I had a little revelation this week. I think I talked to you about it, and I had a cousin who was always overweight. She was pretty much obese. For as long as I remember from when we were children. And she would always say, that she didn't eat that. I don't eat that much. I don't eat that much. And, we looking like, yeah, right. You're eating something,
Right. Right.
Well, and that was the thought process
Yeah.
at that time.
Yeah.
And now when I think about it, and she's no longer with us, but now that I think about it, she had a metabolic disease. She had all the signs of metabolic disease. But now, this is something that we understand now. We didn't understand it back then.
We did not. No way. We just didn't.
And I look at some of the symptoms that I think back, and I'm like, you know what? I bet she had PCOS or metabolic syndrome. Yep.
It's a good possibility. You're right. You're absolutely right. Because so many things that we know goes into this whole pot of making sure we check off all these different checkoffs
Right.
to figure, okay, we're doing the right things to lose weight, other than just calories in, calories
Right.
out.
Right.
We missed the mark so many years ago.
Oh yeah. And I really hope that the medical community comes on in line with understanding the that obesity is not just a personal failure. It's a
Yes.
disease. It's
Like you said,
actually a
that's correct.
chronic disease. So why do women often gain weight during perimenopause and menopause? Let's think about that little
Wow,
system there.
that's a big one too. That's a big one. This one is so exciting to me, and I just can't help when I say
Right,
that. I know
right.
I smile a little bit when every time we talk about it. But with women, there was a really cute commercial I saw today, and I thought, oh my God, that was so perfect.
Mm-hmm.
God, I wish I could think of her name. But she was in a classroom, and she said, we're going to talk about menopause.
Mm-hmm.
And it was a 36-year-old, and she got up and she said, where you going? She said, I'm 37. She said, oh, you sit down, you're in perimenopause.
Yep.
But nobody knew that. When I was
Yeah.
37, you couldn't tell me I was in perimenopause.
Right.
You know,
That wasn't
and
even a word.
exactly.
Never heard
Exactly.
of it. Yep.
Yeah. And when you thought of menopause, you thought 56, they got to be over me in menopause. No
Yep.
period anymore? You got to be old.
Yep. Go home and sit on a rocker and bounce your grandkids because
Mhm.
it's over.
And so
Yep.
I can't wait to see that commercial again. It was just so cute. When you see it, you're going to think about me when you see it. And
Right.
it's just like, oh, no, sit down. This is your age group. Because you didn't realize that when you're in your 30s and mid to late 30s, that you're in perimenopause.
Yep.
And so when you talk to different ladies, and we both experience that, and probably us ourselves, is that we get a little bit older, and all the things we used to do that would drop weight. If we wanted to go to a party back in the
Yep.
day, and you wanted to fit this little dress a little too tight, you
Your
didn't
little
eat that
move
day.
something dress, right?
That little move
That little
something
black
dress.
move
I had
something
one or
dress. There you
two.
go.
We had a couple of them. But you didn't eat a day or so, or I didn't eat that day. As crazy as it was, we didn't know, and it fit. Or even when we exercise, I remember exercising and enjoyed it at the time, but then stop at some point. And then you go back to doing it because so many ladies will say, I'm doing the same thing I was doing before, but just the weight is
Right. Right.
not coming in. That's why.
And you
Because
attribute it to, so now we know how important those hormones are as those
exactly.
hormones start to decrease, especially our estrogen. And we
Oh
talked a
my
little bit about that on our
God.
last episode.
Mm-hmm. Mm-hmm.
Estrogen definitely plays a big role in
Major.
fat accumulation and distribution. And
Mm-hmm. No, talk about that one. Talk about that one.
yep, and not just what we see, and we talked about that
Mm-hmm.
before. We see it collect on your waist. So
Mm-hmm.
when you're
That's
younger, when you gain weight and fat, it kind of collects on your thighs and your hips. Well, as you
mm-hmm.
get older, it starts to collect on that midsection.
Like it's shifting around.
Right now you got to let that belt out a little bit, and you can't button your pants, and don't eat a little bit because you can barely sit down. And
Mm-hmm.
but that's what
Mm-hmm.
you see. That fat is also
Exactly.
collecting in different areas. It's also collecting in your
Mm-hmm.
arteries and around your heart and around your
Mm-hmm.
liver and things. And so it's your estrogen kind of protects you from cardiovascular disease and different things. So you're
Lung,
losing.
brain.
hmm
Mm-hmm.
and then let's talk about some other things as far as how many times have you gone in the kitchen and you get there and you're like, what? Why did I come in here?
Why did I come in
They
here?
call it brain fog. Yep.
Yes. Yeah.
Yep.
I love some of the wonderful, it was either TikToks or Instagram
Oh,
when
yeah.
it was show a lady and she going through her purse and she got her glasses on top of her head
Yep.
and she on the
And she's
phone and she said,
looking
"What are you
for her
doing, Mom?"
glasses and her phone. Yes, yes, yep, yep. And we've all
Yeah,
experienced, well, I've experienced that. I
I've
know.
experienced
So,
it.
so,
And know when you go into
yep,
that room, you forgot what you like. I gotta go back
yep.
and come back in because I know I'm not gonna remember till I come back
Oh,
in.
yeah, yep, yep.
This is how it go.
So,
But that is it. It's the estradiol that we've decreased over
yep.
time, and it's exciting understanding it now and experiencing it. Because when I experienced it at the time, I didn't know what it was. We
Right.
didn't know to look for
And we talked a little bit about UTIs and decreasing estrogen
it.
and
Mm-hmm.
how
Mm-hmm.
it when you talk about a UTI, you're like, oh, okay, they got a bladder infection or something,
Mm-hmm.
but how important it is and how important the estrogen is to preventing it.
Exactly.
And you, I was watching it wasn't a podcast, but it was a like a hearing.
Mm-hmm. Mm.
I think it was a physician talking to the FDA, and she was
Mm-hmm.
talking about how important estrogen is to preventing UTIs, because UTIs is a big issue when it comes to health and
Yeah.
um, and elderly people
Mm-hmm.
becoming septic and different things. And she was talking about intravaginal estrogen.
That's true. Mm-hmm. Mm-hmm. It makes a big
And
difference.
oh yeah,
You probably was listening to Casperson. I think she does a great job with explaining it.
and
I forgot her first name. She's awesome.
yeah, it was just such a
Remember the eye
revelation,
opener?
huh?
Mm-hmm.
And
Remember
of
the eye
how
opener?
something so simple can
Mm-hmm.
help prevent something that can be so detrimental.
Yeah, it is. It's a
Mm-hmm.
big deal because you get the seniors and the older ladies are, like you said, you go into Myers or wherever else, you need to know where the bathroom is because at
Mm-hmm.
some point you may
Yep.
need it before you
Oh
get out of
yeah.
there. You need to know where it's located.
Oh yeah.
That's
Yeah.
one for urgency.
Mm-hmm.
And that's what the estradiol, the cream does help with that. And people say, "Oh, I want to apply it there." It's your body.
Right.
It's your
Right.
vaginal area. Do what you need to do to make sure, that you don't have these issues. And they tell us, I've heard them tell the story, which makes sense, is
Mm-hmm.
that when a woman fractures or have a hip fracture
Mm-hmm.
and they break something and end up, having a fracture, they 30% of those women will die
Yep. Yep.
after the fact, and the rest of them, a good at least 50% after that, will not return to
Yep. They're
um,
gonna have
the state of what they used.
disability for sure. Yep.
And part of that is you think about it, because they never thought about it this way. Think about it. So now you have a female who frequent urination.
Mm-hmm.
They go to bed before a person may think about, I'm gonna wear a pad or something when I go to sleep.
Mm-hmm.
They're getting up at night to go to the bathroom.
Mm-hmm.
Getting up at night to go to the bathroom. Now you have a person who's older getting up to go to the bathroom,
Mm-hmm.
and they're trying to get there quick enough to not urinate on
Yep.
themselves.
Yep.
Let's just put a picture for disaster.
Mm-hmm.
When
So
you could have,
so you talk about that. You talk about the decrease in the volume of the lining, the vaginal lining,
mm-hmm,
and you
mm-hmm,
have bacteria crossing from the
mm-hmm.
rectum because it's such a close proximity, and that's where the
Exactly.
UTI. So if you see, you're going to have the bacteria from the rectum that's causing,
Mhm,
right?
mhm.
And also, let's talk about they also have some osteoporosis because of the decrease in estrogen. So
Mhm,
now you
mhm.
have a whole little syndrome here.
Exactly.
So
And
yeah.
it just plays such a big factor that
Oh
we
yeah.
just know about years ago,
Oh yeah. So
that we didn't know about years ago.
so important. So important. So let's talk about let's talk about strength training.
I like
Why
it.
is strength training so important as you get older?
It goes back to the same thing for Brit, but we just touched a base a moment ago about
Mm-hmm.
that bone loss. That bone
Mm-hmm.
loss happens with the decrease in estrogen,
Mm-hmm.
and we need that. Except some people like don't have to worry about that. I'm always teasing because I'm trying to get up with you with that. We're keeping up with that working out and that strength training. I'm gonna get there. I'm gonna get
Hey,
there.
I think
But
my bike ride, I told you my husband took me on a bike ride. I'm like, what am I doing? But
you did it. You did it. That's the thing, is that we have to
yeah.
move our bones. We have to participate in being active. So, and it's not just the estrogen, which is very
Mm-hmm.
important, but it's also doing other things to go along with that, so that
Right.
we can live longer, healthier.
Right. Right.
Because they talk about them same ladies when they don't increase their bone strength and don't get because they mentioned also too having a DEXA scan to look at before
Mm-hmm.
and
Mm-hmm.
look at after, look in the beginning and look years later to just see how you can really build that up from the estrogen and estradiol.
Mm-hmm.
But if you don't, then that's where those fractures come into play.
Right.
That could
Right.
be hopefully be eliminated.
Right. And then we also the muscle, the increase in muscle tissue. So
Mm-hmm.
muscle has very good metabolic properties, whereas fat
Mm-hmm.
has that negative metabolic impact on your body. So
Mm-hmm.
the more
Mm-hmm.
muscle you can build, and as you get older, you lose muscle mass.
Yes.
And also, when you start losing, if you want to engage in any type of weight loss, you also lose muscle mass. So, strength
Mm-hmm.
training is so important to maintaining that muscle mass. So, your bone health and your muscle mass is so important to your metabolic health.
And I want to repeat something that you just said, and
Okay.
and you said it perfectly.
Mm-hmm.
Anytime, any type of weight loss. So people, not
Yep.
just GLP-1s,
Mm-hmm.
not just GLP-1s, whenever you're
Any type of
losing,
weight loss.
that's right,
Yep.
you're losing muscle mass as well.
Yep, you're going to
It's just,
lose, you're not
yeah,
going to
but
just lose fat, you're going to lose muscle. And that's
mm,
why
strength training is so important.
strength training is so important to that.
Hmm.
So you mentioned GLP-1s. So, and I'm a big fan of GLP-1s.
Yes, we are.
Yes. So are taking GLP-1 medications like semaglutide and tirzepatide, is
Hmm.
it, do you consider it the easy way out for weight loss?
I consider it not an easy way out.
No.
People think it is, and
Yeah,
this is such a myth. It's such a myth.
it
It's
is.
not, and I can't wait till the stigma it's diminished a bit.
Mm-hmm.
But until it's gone, I'll be so happy once
Mm-hmm.
it's just worth talking about. Oh,
Mm-hmm.
yeah. Yeah, but no, it's not easy. We know
It's
it's not.
not. No, it's not easy at all. I had a patient the other day, and she had been watching some podcasts, and she watched an endocrinologist, and the endocrinologist talked about GPS. And
Uh-huh.
she was so excited, and she just completed her first week, and she was down like 4 or 5 pounds on semaglutide,
Hmm.
and she's
That's
so
exciting.
happy. And she
Hmm.
goes, I was watching this podcast, and she talked about GPS, and the G stood for GLP-1s. She said the P stood for protein. I said,
Hmm.
yep, we talked about that. And the S
Hmm.
stood for strength training. And I said that acronym is so important
Like that.
to the composition of
Hmm.
what you need to do on GLP-1s when you're
Hmm.
taking a GLP. And I told her, I said, and let's also make sure we add in our hydration. Hydration
Oh,
is very important.
exactly.
Um,
Oh my goodness. Yes. And so many
hydration.
people
Yep,
forget that. I
it
didn't know
is.
some people don't like water.
I know a lot of people, don't drink water. So I kind of meet people where they are, and I tell them, hey, let's start. Let's start. If
Mm-hmm.
you don't drink any water, let's start. Give me a 16-ounce bottle today. Start with that.
Mm-hmm. Mm-hmm.
And I said,
Mm-hmm.
I keep a bottle next to my bed, and I'll take a sip when I wake up. And
Mm-hmm.
so
Never listen to those lifestyle changes.
yep, start
But
getting
we
into those lifestyle changes. Yep.
Mhm. And
So
it doesn't happen overnight because you get some people that come and they want to lose weight
Yeah.
yesterday.
Yeah.
Or they'll, I've had one, it was kind of funny, and her and I both laughed.
Mm-hmm.
She'll call me like 2 days later, nothing's happened, and I haven't lost any weight yet. And I was on the phone, and I stopped for a moment. I said, I can see her name. I said, how many days has it been? 2.
Uh-huh.
Okay. And she just started laughing, and I started laughing. I said, get off my phone. We were talking. She said, get off my phone. I'll see you next week when you come in. And it was just funny.
Well, they have to realize that it's a process. And, I mean, you didn't gain all your weight in in 2 days. So it's gonna take a little while. Plus, you don't want to lose weight too fast. Got to let people know. Normal weight loss is 0.5 to 2 pounds a week.
Say that again. Somebody need to hear you. Speak on the back.
A
Say
half
that
a
again.
pound to 2 pounds a week is a normal weight loss. And when you lose weight at a rate like that, then your body can kind of keep up with you. Your body can keep up with you a little bit better. And also, I like to talk to people about supplements. So when you're on a diet, and I actually hate the term diet.
I do too.
The reason I hate the term diet is because when you say something about being on a diet, that's anticipating you're going to be off of it and I'm getting ready to go back to doing the things that I used to do. Oh, I can't wait. As soon as I'm off this diet, I'm going to go, I'm eating this, I'm eating that. And so instead of looking at it as you're doing a lifestyle change, this is, and it sounds so cliche, but this is what you're doing. You are changing what you're doing so you can maintain. Doesn't mean you can't ever have a sliver of cake. Now, don't
You're
go
right.
eating half the cake. And I don't expect you to eat cake every day, but it's you're teaching yourself how to moderate.
Right.
Teaching yourself how to moderate. So
And how to just live life healthier.
how to live life healthier. Start getting in that water. Start getting in those vegetables. Getting in your fruit. Realizing that fruit still has a lot of sugar in it, so you have to be a little careful with that too. So,
And some
but
people don't know that, so it's good when they learn.
right,
And
right, right.
I tell people this is a learning phase. It's a learning phase when you're doing that. It's just
Yeah.
take it as that and just improving our lives.
Oh
And
yeah.
it's not just them, because when I tell people when they come in, this is a no judgment zone, because we've all been. We're all
We've all
learning.
been there.
Yeah, yeah. Because even a lot of, again, it's still in the medical community, it's still a lot of people. I'm at one quickie. Is when I was finishing up nursing school, not in school, nursing school. One of my last classes was an elective. The elective was nutrition.
Okay.
Elective. It really wasn't a real thing. Okay, so now they cancel the elective.
Wow.
They canceled it. So I had to take another class to graduate. And so I just said that to say, because oftentimes, they'll say, I go to the doctor, and the doctor tell me just lose some weight or whatever. They don't tell me what to do. A lot of them don't know,
They don't know.
because they didn't get that education
Yep.
in school either.
They don't know. So this is where there's a gap in education, and places and people like us, we're there to fill that gap,
That's right.
the education gap. Yes, we are. So I also like to talk about people getting their nutrients. I like people to see where their everybody's vitamin D is usually low, especially when you're coming off those winter months, because of sunlight. You get a lot of vitamin D from sunlight. And you're in the winter, everybody's inside, and you're not absorbing sun, and you don't. So everybody's vitamin D is low. So I like to get vitamin D levels, because that's very important. I like to B12. Like to make sure people have good B12 levels. I like people to take a multivitamin. That's so important, because as you decrease the amount that you're taking in, you're also decreasing your nutrients. And that's where you get that's another way you get your muscle wasting and your, people
Exactly.
talk about hair loss. And hair loss is not, the GLP isn't causing hair loss. it's the
Exactly.
lack of your nutrients because you're not taking in as much. So
That's true.
I like to focus a lot on nutrients with people. So very important. So, what is the are the biggest nutrition mistakes that you see people make when they are in a weight loss situation?
One is I see people, and I understand they're trying to be healthy because sometimes they just might not know. They'll eat a lot of fruit.
Okay.
When I
Yep.
ask people about
Yep.
smoothies, and smoothies, I mean, there's nothing wrong with having smoothies,
They taste
but
really good.
they taste really good.
Yes, they
And,
do.
they'll start asking, well, what's in your smoothie?
Yeah.
And I ask them, put more vegetables in there. And then as far as the fruit, put it just enough fruit so that the taste is not terrible that you don't want to. Because I can ask somebody this, I have pineapples, I got straw. It sounds wonderful.
It
Pineapple,
sounds
strawberries,
so
this and
good.
other.
Yeah. Mango. Yep.
Mm-hmm. It can't help but taste wonderful,
Yep.
but it's filled with so much sugar. And so
Lots of
those are
sugar.
just some myths that people have. And then when they think about it, they're like, that is true.
Right. Well, we've been taught, and it's not that fruit isn't healthy, but it also has a lot of sugar in it. That's why it tastes good.
Exactly why.
So,
We've grown up on sugar. And like what you said, if you prioritize the protein and then have the some of the fruit afterwards, like I tell them, the fruit is going to shoot that blood sugar up all the way here. You have the protein. The protein is not going to shoot it up as high as here. Then
yeah,
you have the fruit right afterwards. It may go up some, but then it will equal out sooner.
right,
Opposed to going straight up, then you got to wait for it to come back down.
right,
So that's in a sense how I try to teach them as far as the sugar. Because it's
right.
delicious.
It is. So you said something earlier about people decreasing the amount of nutrients they take in, the amount of food, and they think when we are taught eat less, and they keep eating less and less and less, and so that's a big mistake too, because you get a big fallacy where people think that you're supposed to cut out, okay, I'm only gonna eat 500 calories a day or
Exactly.
800 calories a day. So and your body is going to adjust to that. Our bodies, our metabolic systems are very they can adjust to that. So your body doesn't know
It's
why you're not.
wonderful. Our bodies are wonderful if we
Yeah.
treat it right.
Your body doesn't know why you're not taking in calories, so it better hold on to what you have. So it's
Because we don't know
gonna.
when the next meal's coming.
Yep, exactly. So while you're thinking, and it's because of the fallacy of what we've been taught. Now you're holding on. Your body's holding on to all those. Hey, I have to have those stores of fat. So in case, because I don't know why you're not eating, but you're not eating, right? Okay.
Exactly. We're not
So
eating, but we don't know why it is, so we go hold on to this until the next meal comes.
right.
Figure this out.
And so, not taking in enough protein during, we've mentioned protein multiple times because it's so important during
It's
your
so
weight loss.
It's so
Yep.
important. And oftentimes we just didn't know how important it was. We didn't realize just how important protein is.
Well, I think sometimes meat gets a bad rap. Meat and then other sources of protein. Sometimes it's a challenge when you have a vegan or a vegetarian to work on getting enough protein in.
It's hard for me to get that
Yeah.
protein because you don't absorb as much protein from non-meat.
Exactly. Exactly.
Maybe 30-40% that you may need. And that's one thing. People talk about meat, and I'm not going to go back and forth with anybody as far as what
Right.
their choices are. But when you eat a good piece of meat, I'm not saying with a lot of hormones, something that's hormone free or organic,
Right.
however you want to look at it, you get the most vitamins
Right. Right.
out of meat.
Right.
Many people don't like to think that, but it's so true.
It is true.
Again, you can still find those with, a vegetarian or pescatarian too, but, it doesn't absorb as well. You don't get that same amount.
Exactly. Exactly.
But it is doable, so it depends what a person's preference is.
So, if somebody could make one health change today, that would have the biggest impact on their life or on their health, what do
Wow.
you think that would be?
Oh my God. You gonna ask me for one?
Well, I mean, there are plenty,
And that's just so many.
plenty.
One, I would say, good goodness. If I had to think of one,
You tell me
and
what
I
you
know what
say,
it's
and I'll tell you what I think.
okay. Okay, I'm actually repeat my question one more time because I'm like,
Okay.
oh,
If somebody were to make one change that would have the biggest impact on their health, what would that be?
well, you know I can't answer that because it's so big. One would be, okay, okay. One would be decreasing the amount of sugar because that's one of
Okay.
our issues with obesity.
Mm-hmm.
That's one,
Mm-hmm.
but it's hard to just say one. So I'm gonna let you do the other. That's so many others. That's
I
one.
would say moving the body and strength training.
Yeah. I mean, that's what I'm saying. It was hard for me to say one, but I
I
was
know
trying.
there's so many. There are so many,
But
but
even those are two of the major ones,
yep,
though. That I mean,
yep.
even just those two right there.
Mm-hmm.
Those two right there.
Mm-hmm. Moving
Hmm.
the body, strength training. Um, I think strength training is contributes greatly to longevity,
It
and
does.
it's the fountain of youth.
It really is. And we think about that. We can spread that word a little bit
Mm-hmm.
more. That will make a big difference.
Oh yeah,
It is the fountain of youth. You said that.
it's the fountain of youth.
And with women realizing that strength training does not mean that you're going to be buffed up looking like a man, it doesn't mean that at
Right,
all.
right,
It
right.
means longevity. It means extending your life to
Mm-hmm.
add more, as I tell people, add more years to their life and not more just life to the years.
Mm-hmm.
Make a difference in how long you live with your grandchildren, being able to get on the floor, off the floor, being able to play with
Yeah,
them opposed to them just looking at you in a hospital bed. That's what that
exactly,
means.
exactly,
Making a
exactly.
difference.
Okay. So, what advice would you give to somebody who wants to embark on their health journey?
Mm. Think about their why. Why?
Okay.
Because oftentimes, and it's interesting because usually when you ask a person their why, at least my experience has been, it's not always about them.
Mm-hmm.
I think because, love is such a big difference, makes such a difference in our lives, that it's usually about somebody that they love and care about.
Mm-hmm. Mm-hmm.
Um, I used to ask people, what's their reason, what's their why?
Mm-hmm.
Because sometimes, you know, as you know, because you're consistent when it comes to working out, the consistency doesn't come from motivation.
Right.
Not always.
Right.
Sometimes it does. But sometimes you need to reach for that why or whatever reason you're doing it for
Yeah.
to
Yeah.
find that motivation to do it.
Right. Right.
Hmm.
Yeah. I had somebody come and it was their kid, their adult kid, and that kid was having a kid, and he said, "Am I going to be without my mom, or are you going to do something about it?"
Oh, that's a strong one right there.
That's a very strong one. Yep.
Mm-hmm.
And so that was
Mm-hmm.
her motivation
Mm-hmm.
to embark on her health journey.
And that's a lot of their
Oh
motivations. And
yeah.
but again, it's somebody else. And usually it's those little ones.
Oh
Because
yeah.
those little ones make you want to change and make the world a better place.
Oh yeah. So, and I will send a tribute out to my three grandkids. I just had a third one. So my first
Yay,
one,
congratulations.
Harmony, is about to turn 18. So
I remember her. Oh my God. I remember when
yes,
how was even a
I
child.
know. Rowan just turned 1, and little
Oh,
Ashton is just a week old. So
yeah. See,
hi,
I'm gonna get a
hi
shout out to
guys.
you. But you're a perfect example of what grandparents look like now.
Okay, yeah, okay.
Because our grandparents did not look like how you all look these days. I still got to get that content now because you were in that one, yeah.
Oh
What
yeah.
grandparents, BG, Lovey, all the different names you all have for that now,
Mm-hmm.
but the love still ends up being grandparent. Y'all
Yeah.
don't look like our grandparents did back in the day.
Oh yeah. Hey.
You don't at all.
No.
So,
Wearing moose
that's
something
what you
dresses
do.
and bikinis. There you go.
Yeah. They said they back in the day they had the moo and the house
Yeah,
coats and
no, nope, nope,
fluffy.
nope, nope, not here. Nope.
It's a difference now. This is
So,
different, but that comes into what you do. That's
oh
what you
yeah.
do.
Oh yeah. So, Any last words of wisdom? Any
Um,
pearls?
oh goodness, what would I say? Start your health journey now.
Mm-hmm.
Start it now.
Mm-hmm.
Uh, because I mean, you can do it at any age.
Right.
Any age you can start it, but start it early so you can carry that on into your later years.
The earlier you
There's so many
start,
benefits and so many things. Mm-hmm.
the more you preserve.
Mm-hmm. The more
Um,
benefits you have from that,
yep.
yes. Start
Exactly.
now. And
Exactly.
it's never too late to start. And don't think that because you may
Yep.
have such a bad habit, you can't start. All of us is.
Exactly. Exactly.
God gives us the grace to be able to start wherever we are. So yeah,
Yep. Yep.
and we just so happy to be a part of it. When I say me,
I
me and you,
know. I
when
know.
I say when I come on, I appreciate you mentioning my business, my company, but you right there with us. It's not just one. They can come to me, they can come to you. Corbett.
Well, you took care of me, so
I,
you're the one that gave me that inspiration to, like, oh yeah, maybe I can do this too.
Mhm.
And I truly enjoy doing it, and truly enjoy
And yeah,
seeing
we
people get
truly enjoy.
healthy.
Because I'm gonna say this because I remember us in the ICUs at
Mm-hmm.
Sinai Grace Hospital,
Mm-hmm.
and true enough, we saved a lot of lives. We
Mm-hmm.
saved a lot of lives. We learned a lot there.
Mm-hmm.
Um,
We
but
did.
it's nice to be able to treat people early on
Mm-hmm.
to help them not to get to that point.
So we are practicing prevention as
Yes.
opposed to curing.
Mm-hmm.
Yep.
That's true. That's true.
That
So I'm so
feels
glad.
that
Thank you.
feels good.
Who would know that 30 years later, 20 years later, how many
Yep.
years later? It's been a
Yep.
long time.
A lot of years later.
That we would have been from there
Yep. Yep.
to where we are now.
Yeah.
Practicing
So,
prevention makes a difference.
well, thank you, Deb, for um, continuing this important conversation. And I look forward
Thank
to
you.
talking some more about it because it's so important. I've got some other topics I want to talk about. And
Oh my goodness.
so,
I forgot about the one we saw this morning.
oh, yeah. Oh, we did. We forgot about that.
Oh my goodness.
GLP-1s and safety. We almost
Yeah.
forgot. Yeah.
Do we have
So,
time?
yeah, we have some time. So,
Okay.
yeah. So, on the Today Show, they were
Mm-hmm.
talking about people overdosing themselves on GLP-1s.
Mm-hmm.
And
Mm-hmm.
yeah, tell me, give them a little highlight of what
They were
happened.
talking about if you had a chance to take a look at it, and I'm not downing what is it, telehealth, because we
Mm-hmm.
do some telehealth medicine as well,
Right,
but
right,
mine from different companies. But what it was is people were ordering GLP-1s. Again, don't nobody throw shade and calling me and send me different different texts
right,
and Instagram,
right,
but they were purchasing and may not have been aware of how to properly dose it.
right, right,
And so people were, as they would say, were overdosing on the GLP-1s. They weren't dying off of it, but they were getting very sick.
right,
And they
right.
had one lady in particular that they showed from one of the popular telehealth companies.
Mm-hmm.
And oftentimes when you ask people, well, our people know what they're on. I'll say
Right.
that.
Well,
Our
my
people,
people know what they're on.
they know what they're on. If you ask how many milligrams, exactly they know what doses they're
Mm-hmm.
on. But if you ask some people, they'll tell you how many units.
Right. They don't
Um,
understand dosing. And
mhm,
so they don't understand that there are different concentrations and that units does not tell you how much
mhm,
medication you're on.
mhm,
And I spoke with a gentleman a few days ago and I asked him what dose he was on because he was looking to switch providers. And he couldn't tell me how the dose. He could only tell me how many units. And I said that doesn't tell me what your medication is.
mhm.
And so I've even run into healthcare providers who didn't know the dosage that they were on because a lot of the companies they don't tell them how many milligrams they're on. So when
Well, they
you
tell them they don't really recognize. They'll
right.
send them in the mail. They send in the mail. They get
Mm-hmm.
it, and you have to draw it up.
Right.
Um,
And they only understand that, well, I've got to draw up 30 units.
mhm.
And, they don't understand that there could be various concentrations. And
Right. So someone
yes,
call and ask
exactly.
us, okay, well, they told me to do this, and I can't tell you what it is because
Right.
I don't know,
Because
and
I
I'm
don't,
not going to
right,
guess on anything.
right,
Exactly.
right. So yeah,
Exactly.
we have to really work on educating people, and
Mm-hmm.
as providers, and whether it's telehealth or in person,
Yeah.
they have to really be vigilant on teaching people about dosages and explaining to patients that, okay, this is the dose in milligrams that you're on, because that's
Mm-hmm.
how things are
Because you do want to know, and
prescribed.
some of the
Yeah,
side effects, and just having a hands-on or having someone to be able to call a reference. Because I mean,
exactly,
there are side effects, things to happen. Uh, the support that we
exactly,
all need, because this is a
exactly.
medic, and that's what the lady said, which makes sense. This is a medication.
Right,
This is not
right,
looking for a sale price for something, and you go to the store,
right,
on some shoes or something. This
right,
is your health.
right, exactly, exactly,
And I understand people shopping around for different pricing, but
right,
this is your health, and you do need that support, education, that can be provided to you for that.
right,
And the
right.
lady said that she had called. She said she had one dose. She said the dose wasn't working, and probably at the point that she needed
Mm-hmm.
a higher dose.
Mm-hmm.
They sent her a higher dose. She said she was a little nervous, so she
Mm-hmm.
called and said, "Some of this is a pretty high dose from what I had."
Mm-hmm.
And the person, whoever she talked on the phone, said, "Well, follow the doctor's orders,"
Mm-hmm.
which was the amount that is said on the vial.
Mm-hmm.
And we don't, I can't say what that was, but they say it was like 5 times, what was it, 5 times greater than the dosage it
Wow.
should have been.
Wow.
Again, don't quote me, but I'm sure that's what it said. And no, and it said, it said it was five, well, let me say this. She talked to a nurse, maybe where she worked or a nurse that she
Mm-hmm.
knew. And the nurse told it was 5 times the dosage of what she should have had.
Mm-hmm.
Again, I can't say, but she didn't give herself the entire 5 times the dose. It was like a third of. Whatever it
Wow.
was too much. She was in the hospital for about 3 or 4 days.
Wow. Wow.
Yeah. But,
So
so if
yeah,
it would have been more communication, it might
right,
have been fine. So I
right.
can't say, but
Yeah, they have to understand that different pharmacies and different providers have different concentrations of drugs,
mhm,
and
mhm,
units don't necessarily, even the same provider can have different concentrations of the same
exactly.
drug. So
Exactly.
have to
So
be,
we're not telling, don't do telehealth. We're just saying,
all
be
right,
cautious.
just be
Be
cautious.
cautious.
Watch out for your own
Hmm.
health. And
Hmm.
if you have to consult your own provider, then maybe you need to consult your own provider if you are um, if you can't get an answer from the other whatever company you're working with. So
Exactly.
okay,
Exactly. It's your health.
yeah,
And you do have to be your own advocate, whether it's for
yeah, you have
GLP-1s or
to.
anything else or other medications.
And
But
GLP-1s are wonderful drugs, so they
they
are they are
I would do it
wonderful.
I would do it all over again if I
Oh
had
yeah,
to. I really
oh yeah,
say that.
oh yeah.
This was a game
So
changer.
yeah, I'm glad you remembered that part. Yeah, I would have been sad if we hadn't remembered that.
Yeah. But if anyone's able to go back and take a look at it,
Yeah.
it was today. It
Mm-hmm.
was worth looking at, no matter, whether you
Definitely,
own it, and make
definitely.
it help somebody else by helping them, for them to make that decision.
Yep,
If you
yep.
want people you can talk to and, be supportive, and this is it's still not a game. It
Right.
seems like it's a lot of um, people that you can get it, and you can. It's just, I've heard other stories where people have gotten the medication. I thought, wow, I'm
Mm-hmm.
not gonna say too much when I say that.
Right, right, right.
I've heard some strange
Yeah,
places, I
you have
guess.
to be careful. You talk about reconstituting and different things like that. So you have to really be careful.
Hmm.
So
Hmm. But I understand, and it is a game changer, so
it
it's
is
worth
definitely a game
investigating.
changer. So, but a lot of good companies, a lot of good pharmacies out there providing definitely
Because
much needed help for people.
and when we know it's not for everyone, but investigate. Oh, this one lady came to my office. She came in for fat burner and a
Mm-hmm.
vitamin, and she talked about wanting to lose weight. So that's what she familiar with GLP-1s, and she said, kind of. I said, well, not, I don't try to force anything on anyone, and
Mm-hmm.
I just asked her why does she did not think about it or give it some thought, and she said, cause way it makes you look. I said, oh, she said, because everybody has that look, and I said, well, not everybody has that
Mm-hmm.
look, but she didn't know. So that was her take on it. That was her thought, you know. So I
Right,
showed her some
right.
pictures. I showed some of my pictures and things like that. And she said, "Okay, the people I thought were taking it were the ones that she saw looked sunken and looked like
Mm-hmm.
they, she just didn't like the way that they looked." And I just told her, "You don't lose it fast, and just, just give some education on it." So
Right,
whether
right.
she does or not, at least she has a better outlook and
Mm-hmm.
truth to how people utilize it and how
Right,
it works.
right. And it just that comes with education
Hmm.
and
Hmm.
having somebody help guide you through your treatment. And a
Hmm.
lot of people want to lose weight really fast, and that's a lot of times when you see that drawn, sunken look.
Hmm. And that's, again, when you have that drawn, sunken look, that's fast weight loss,
Mm-hmm.
regardless of GLP-1s, if
Mm-hmm.
it's
True.
anytime is fast,
Mm-hmm.
and they're not doing collagen and protein, like you
Mm-hmm.
said, that's when you get
Mm-hmm.
that look. And
Right.
that's what she meant. It was that look. She's
Right.
that
Right.
was what she saw that she didn't like and didn't want. She was a beautiful lady, so I can understand that, you
Right.
know.
Right.
Hmm.
Okay. All right. Well, we got that in. I'm glad you remembered.
I didn't
So,
mean to take that long,
no,
sorry.
that was good. That was good. This is an important
It was
point.
interesting though.
Very
It was
important point.
interesting though because it's a nice amount of people who just pay more attention. That's
Right.
all.
Right. Yep. Educate yourself on your own health.
And that's it
Yep.
right there. And that's when it comes to everything:
Mm-hmm.
diabetes, hypertension,
Right.
all of that.
Right.
Menopause. I'm telling
Right.
y'all, that's it's a
Right.
big one.
Yes. Yes. So, all right. Well, thank you for this important conversation. We will definitely continue because I got some more stuff I want to talk about.
Oh, that's right.
And this was some excellent information. And I would like to thank our other sponsor, Brilliance Wellness Care.
Yeah.
And you can contact them if you are interested in a weight loss journey at 313-213-9357. They have locations in Michigan and Ohio. Thank
Hmm.
you to my listeners and viewers for spending time with us on Ignite Your Next Phase with Dr. Angela. So keep growing and glowing and keep believing in yourself. And until next time, Ignite Your Next Phase with Dr. Angela. Let's talk about it.
Thank you for having
Thank you,
me.
Deb.
Till the next time.
Till the next time.
Ignite the spark with Dr. Angela's eye. Step into the future shining bright. Helping students reach new heights.